Good morning. Welcome back to Open Med School. I am Dr. Andrews. We have discussed about cardiac failure. Today we'll be seeing a patient and try to stage the disease and class the symptoms. So this is a history. It's a 65-year-old female. She is non-hypertensive. She has got increasing shortness of breath with the minimal activity such as walking short distance at her home, which is interfering with her activities of daily life. She has got significant fatigue, difficulty in sleeping at night due to breathlessness, and has swelling in her ankles that has worsened over the past few weeks. She has elevated JVP on examination and bibasilar crackles and pitting pedal edema in her lower extremities. An echo revealed left ventricular ejection fraction decreased and there's dilatation of the left ventricle. And this is the history. So, what we are going to discuss is how will you stage this patient and how will you class her symptoms. There is a confusion regarding stage and class. Stage is the class is for symptoms, and the stages are the disease progression from asymptomatic to symptomatic. And that is the way we can remember. So first let's look into the stages of heart disease. You divide into stage A to stage D. C and D are symptomatic. So these two stages are symptomatic. Stage A is at risk of heart failure. That's the stage A. So you have got a genetic predisposition or you have got a disease that can produce heart failure. For example, you have got a gene abnormality that can produce heart failure. Dilated cardiomyopathy, there are various genes we have discussed last day. You have got hypertension, which can produce later problems. So that is what is called stage A. So stage A, they have got no symptoms, no structural or functional problems. So what are the conditions? If you have got hypertension, you have got coronary vascular atherosclerosis, which has not so far produced any symptoms, diabetes, obesity, exposure to cardiotoxic drugs. So for example, somebody is exposed to anthracyclines. These are all examples of stage A. Of the stage A is clear to you. Stage B is pre-heart failure stage. So people with current or previous symptoms of heart failure but with either structural heart disease or increased filling pressure in the heart or other risk factors. For example, suppose you have got hypertension and it has produced a left ventricular hypertrophy. So there is a hypertrophy of the left ventricle. So it has produced a structural problem. Or somebody has got an aortic stenosis. He is asymptomatic now. Again, has got a structural problem. So it's a pre-heart failure. So hope the pre-heart failure concept is clear to you. Pre-heart failure means the patient has got no symptoms now or previously, but has got a structural heart disease or increasing filling pressures in the heart. So somebody has got a diastolic dysfunction. We have discussed about the systolic and diastolic heart failure. So patients with a diastolic failure, the filling pressures may be high. So that is so stage A and B, there are no symptoms so far. Now comes to stage 3. Stage 3 is the symptomatic heart failure. So patient with what are the symptoms of heart failure? Symptoms of heart failure are palpitation, breathlessness. These are the major symptoms that you should keep in mind, and fatigability. So these are three cardinal symptoms which usually you class in the. So class are four symptoms. Stages are the different stages at which patient comes. And now we go to stage D. Stage D means people with heart failure symptoms that interfere with the daily activities or lead to recurrent hospitalizations. So let us take our patient. Our patient has got symptoms which are incapacitating. Here and daily activities are interfered with. So our patient is having a, can definitely say patient has got a stage D disease. So initially patient had a hypertension. At that stage the patient was in stage A. She progressively might have developed a left ventricular hypertrophy. Then as the patient went on to symptoms, and now the activities of daily life is interfered with, and echo has shown definitely there is a structural problem. In addition, has got clinically elevated JVP, pedal edema, bibasilar curves indicating the patient has got a biventricular failure. So hope this explanation is clear to you.